Good morning, everyone. Today we're going to be starting with some 5.8 training. Before we get started, I want to make sure that you understand that there were very few modifications made to 5.8 that will affect the EHR. 5.8 is actually the foundation for our billing structure and our scheduling structure. And while there were some changes on the AHR side, they were more in the line of enhancements as opposed to real changes. I'm going to briefly go through those today. The biggest concern that we'll have is when we make the 8.3 conversion. That, of course, is going to primarily affect the EHR side, and that date is set for in and around, I think, May the 19th. To log into 5.8, you're going to look for an icon on your desktop that says NextGen, and it's going to say Test. Select your icon, and you'll just go ahead and log into the EHR as normal. We reset everyone's passwords to password 1, so you'll use your user ID as you're using right now, and then you'll put your password in there as password 1, and then it's going to request you to change your password to a password that you select, and you're welcome to use the same exact password that you use for production right now. After you've entered in your password, you'll notice that your screen here hasn't changed, and you'll hear me say that throughout the training today. It's going to take about 30 minutes. The majority of them haven't changed. There's very few changes in the HR side. Open up your patient as you normally will. Remember, this is in test mode, so you can use any patient that you want to use while you're in test. I'm just going to actually just use a test patient. And you'll notice that when I open up my test patient, one of the first things you'll notice immediately is this patient information bar. The patient information bar right up here at the top displays in NextGen EHR above the current open module or the template. The bar is going to remain visible regardless of the module or the template that's open. So as you see yourself move through HR, this information always going to be available. The one thing that you'll notice here is that you have your patient's name. You'll still be able to see the patient's name, their date of birth, the information right up here at the top. But this is a new patient information bar to allow you to access information without moving around throughout the chart. It has the patient's name. Obviously, it's got the date of birth. It's got their weight. You'll now notice that you have your allergies listed. You have your problems listed, your diagnosis, and the medications. If you hover over the top of the number next to the allergy or to the problem list or to the diagnosis, you're going to notice that a grid is going to pop up, and this literally just contains the information at this point that you have in the allergy module. The same information from your problem list, the same thing from your diagnosis module. Now you notice this patient has a lot of diagnoses in there, number 321, but you only have about 30 that you're able to see from this list. Anything above and beyond 30 is truncated, which means you're going to have to open up the module and look at it. Now rarely do you have this many open diagnosis codes for a patient. But for a test patient, because we've used these for play, there are a lot of different diagnoses. And then, of course, the medication module. Now, you can only hover over the top of them to view the information in a grid format. You are not able to open up the medication module from double-clicking. You'll still have to open up the allergy module by either using your template preferences here, or if you have those set up across your top on your custom bar, you're able to use those. The next thing you'll notice is the patient's address. And if you hover over the top of the contact information, it gives you the home, the daytime number, the email, and their cell phone number. Prevents you from having to open up the module. You're also able to hover over the insurance and look at the insurance of record. The insurance of record, care for this patient, was the last insurance given. If the patient had a nickname, it would show here. And if they were part of the NextMD or the patient portal, it will show yes or no that they're part of the portal. You'll notice here that we're going to try and incorporate a medical record number. This makes it easy for the lab staff to be able to access a medical record number and the x-ray staff for documentation on lab results and x-rays. This is the pharmacy information, pharmacy number 1 and pharmacy number 2, so at a glance you'll be able to determine what their pharmacy preferences are. And you'll notice that it'll have the PCP's name here if that selection is made in the system, as well as the rendering provider. Your rendering provider is always should match the encounter that you're working on. You'll also notice that you have 3 different template preferences that you're able to pull up quickly. You have your adult chart summary, and you're just able to quickly review through here. You're able to look at your telephones, you're able to look at their medication list. You can open up the medication list, look at their chronic problems, also look at their allergies, view a history of the types of office visits, any orders that were put in, blood pressure readings, assessments, their vital signs, telephone call history, their weight, past medical history. This information I just put there for your convenience should you want to use it. By no means do you have to. I'm going to close that out. You have your FHCA patient information. This is literally your demographics. In the past, you would have to open up the demographics from over here under patient and select demographics here, but you do have a quick reference here. And the last thing is the PHI log. The PHI log just allows you to look to see who information has been distributed to outside of Family Healthcare Associates. I'm not going to save any of these, but you'll notice. Now, one of the things that a couple of the doctors had made mention of, they're concerned because, well, this patient information bar does take up quite a bit of room, and they don't like scrolling. So if you prefer not to have your patient information bar, you do have the ability here to expand it or collapse it. By clicking the arrow here, it collapsed it, and then if you click it again, it'll open it back up. I'm going to leave it collapsed for now because I do find that it takes up quite a bit of space. We've opened up a new encounter on this patient, and I'm just going to go into, you'll notice your templates has not changed. Now, if the templates have changed when we copied 5.8, you may need to modify those templates if you need to. You'll just select Tools and your Preferences, and you're able to go over here to Templates and select the templates that you want by highlighting it, using your arrow to move it over to your preferred template, or to take these templates out. And I notice that I see a lot of doctors that still have something that looks like ZZ temps and some of these ZZ retired templates. We're not using any of those templates. So if you have that template, you're going to want to take those out and make sure that you have the comparable at template. Once you're through with the modifications, just put apply and OK. So I'm going to open up the intake screen on this patient. This is where the medical staff will start doing their documentation. And I'm just going to select the reason for visit as being an office visit. And you'll notice nothing has changed. Nothing changed on the intake screen at all. You still have the ability to go into your histories, your summary, your SOAP, your finalized office visit, and your checkout. Nothing changed on any of those. You'll use your current process right now. You're still able to access the OB-GYN detail, their sticky notes, their HIPAA, advanced directive screening. There are no changes on this whatsoever. Now I'm going to scroll down just for everybody to review, but there were no changes on the intake screen. No changes on history, no changes on summary, no changes on SOAP. Nothing with regards to your finalized office visit or checkout. When you look through here, you're still able to go into the chart abstraction. There were no changes to the chart abstraction document. There were no changes to the custom lab letter. So if you're a physician who likes to generate your lab letter documents, there were no changes on the custom lab letter. There were no changes on your finalize your office visit. When you open up your immunizations, you'll still order your immunizations and disposition your immunizations and review previous immunizations as you've had. Orders management, there were no changes in orders management. Provider test action, you can still generate a provider test action, have your staff position it, and generate a provider test action document with no changes. There's no changes on the SOAP screen, no changes on the telephone call template or documentation, and nothing on your documents and letters. There were a few changes to the EHR, and those are the ones that I'm going to focus on. Besides the patient information bar, remember you can expand or collapse it by clicking the arrow next to here on the end. The biggest changes that you'll see most immediately are in the medication module. And while these are not major changes, I do think they're worth noting. You'll notice that whenever this, pretty much no changes as far as what you're able to review, your grid preferences, you're prescribing your new medication. These lists are the same. It does have the new reconcile button on the actual medication module. The reconcile button really is just for the purpose of reconciling any medications that are coming in either on a continuity of care record or maybe something that's being pulled in from a health information network or an HIE. So as a rule, you don't need to reconcile your medications. I do encourage you to still have your staff go in and review the medications with the patient and document that they've reviewed the medication, but reconcile function is mostly a meaningful use component. Back into the medication module, one of the biggest things that you're going to notice is the information right here. Whenever you renew, say for instance we're going to renew a medication, you'll notice that the information and the way it's listed on the SIG has changed. In the past, you had to go through and you change every component. But if you want to, you can just click anything in this area, and what it will do is it allows you to go in and put how the medications to be administered, your quantity, your units of measurement, your intervals, your interval unit, duration, all on one, without having to go through each individual component. And then of course don't forget that you do have the ability by using this drop down arrow to look at your most used or to look at the first data bank the way it's most commonly prescribed, and you can just use your arrow to scroll through and select any one of those that you might. So if for instance I might normally take this one tablet every 8 hours for 5 days, or if I were going to take this one, I could just shift over to that. I can clear that SIG out if I want to and add a brand new one and just say that, whichever ones I want. I'm going to cancel it, but you do get the understanding of what you'll be able to do. Beyond that, there were no changes on the medication when dispensing the medication. When you go in to prescribe a medication, there have been no changes in your prescribing your medication. It's the same as what you've had in the past. There was one small change whenever you hit send the prescription, and I'm not going to check eligibility, but if you do check eligibility, reminder to check your eligibility on a day-to-day basis, looking at your appointment information. And if, say for instance, remember this is in test, so there's not really any appointments, but if you do get in the habit of you or your staff coming over and trying to refresh, looking at your batches on a day-to-day basis, that does help out as far as cutting the time down that it takes to check your formulary. When you click send, I'm going to say no. You'll notice that when you send a prescription, the same thing as what you've had. You do have the ability to force it to a fax now. So if perhaps this is not, ERX is not available, you're able to just select force fax, and you can select your pharmacies as you have in the past. But one of the big differences that you'll see right here is this manage patient pharmacies. And now you have the ability to come in here and put a pharmacy number 1, a pharmacy number 2, which are going to pull from the patient demographics. And you also have the ability to look at a mail order. So if I added a mail order pharmacy here, and I'm just going to put something here. In this case, I'm going to select Express Scripts. And I've now added that to my pharmacy, and I selected Save. You'll notice now that I have the ability to select all 3 of those pharmacies. You'll notice that by highlighting the mail order prescriptions right here, it's saying that the patient is not eligible for an ERX type situation. And then you have your additional prescription detail. Beyond that, there's not really many changes on here. We are in the process of doing some updated on regards to EPCS, that's electronic prescribing of controlled substances. We have a couple of physicians who've actually been testing for this, and we're finding that more and more physicians and more pharmacies are now becoming part of the electronic prescription program, which will allow you to prescribe your controlled substances using a 2-part authentication process that will bypass you having to fax anything in, and of course the whole wet signature situation. So within the next probably month, you're going to see we're going to have more and more physicians that I'm going to approach to see if maybe they might want to consider moving over to electronic prescribing. I think that you'll find that a benefit. Beyond those few changes that we talked about on the SIG and the addition of the information on your ability to manage your pharmacies. There really weren't any other changes that you'll notice in the medication module. You won't find any changes in the procedure module. You really won't see any changes into the allergy module. We went over the medication module, your orders module. Everything is pretty much the same with no changes there. You will see some slight changes that you're going to see in the diagnosis module. And I am going to spend some time going over the diagnosis module. A large percentage of the physicians don't really utilize the diagnosis module the way it needs to be. But I think it's just a preference on your choices on how you like to use it. You're still going to be able to look at your schedule. You'll still look at any old, these are all old stuff that were copied when it came over to test, and you'll still be able to look at your inbox. So nothing to be concerned about there as well. There were no changes whatsoever. I did go into the PAQ yesterday and do some looking just to make sure there were no changes in the PAQ. And on the PAQ, the only changes that I noticed was the information that we have listed right here. This section has changed somewhat. It gives you the ability to review only your selection. So if I only wanted to look at the orders, or if I only wanted to look at maybe ICS documents, and I only wanted to look at, but I didn't want to look at orders, if I select and say I only want to look at those items and hit refresh, then it just gives me a listing of those specific items. If I just wanted to look at orders, then I would just select orders and refresh. And then you're still able to review your documents and your images just like you have in the past. Really, there were no changes whatsoever that at all. Beyond that, you still have the ability to accept. You can still send a task. You can still open the chart from this area, reassign it if perhaps you received it in error, and your options haven't changed at all. You still have the ability to look at your pending, your rejected, and your history. You still have the ability to look at all your different templates the way you have up here at the top. And the biggest change, though, that you'll see outside of the ERX module is the diagnosis module. The diagnosis module enables you to list and maintain medical problems related to each patient, medical problems added to the patient's medical record using the diagnosis or the problem module are categorized as either active or inactive. And you also notice that you have a problems list and you have a billing ICD list. To access the problems module, you can just select the DX, or I have it as a shortcut here at the top. You'll notice that I've got the problem list. You go to the billing ICD list, but the problem list, literally you have the ability to look at a problem list, a display grid, and then you have the ability to do some modifications on the entry grid. But this basically is just going to display a tool. The problem list display grid toolbar is located at the top of your grid, and that just basically allows you to refresh it, to select your preferences. If you wanted to change your preferences to set different columns to display, that you can do that. You also have the ability to look at your status selection. The status selection allows you to specify whether you want the displayed grid to show all statuses or only show active. So if I select that, I can say I want anything listed that has an active status, or in this one I just want to show active statuses. The next one is show my track problems. You have the ability to display only the problems that you have that you've added to your track problems. That allows you to track your problems. And of course the show chronic problems will just allow you to look at conditions that you've listed as being chronic. The next thing that you'll notice is you have a description, you have the chronic, and next to these you're seeing a little pin. What this pin does is just allows you, if you click this, you're able to just kind of move things around and put everything in a different order that you want it in. If you wanted the description first, you wanted chronic to be secondary, and if I wanted secondary to be pulled over here, then I can just really click it and drag it and move it around and put it in the area that I want. You'll notice that I've said that I wanted to look at my active and here's my resolved. Here's my chronic problems. If you want to minimize those or expand it or collapse it, you can use this little arrow next to it. Knee pain, the little plus sign versus a negative sign. And then you can look at that, and then you can mark it as to whether it's going to be a chronic. This one I've had listed as a chronic. If I wanted this knee pain to be chronic, then I would highlight chronic. And then you also have the ability to right-click your mouse on any one of these conditions and look who put the information in there. You can refresh your screen. You can add a new diagnosis here. You can resolve one. You can set it to a chronic condition. I've set mine to a chronic condition by right-clicking, and then when I hit accept, now you'll notice that it's set up as a chronic condition. On the urinary tract, if I selected my urinary tract infections and it's not inactive and I want to resolve this one, then I can just click resolve. And then I'll just go ahead and accept that one by clicking accept. So you're able to look at your active and your resolved and make sure that you use your plus or your minus key next to the active and the resolved so you're able to track it a little bit. You also have the ICD billing. It's the second listing, which is the billing list. And basically what this is it displays all the resolved and unresolved billing ICD entries for the patient's problems and the details that they've entered under the each billing entry. It also shows you or allows you to make the modifications to the data associated with each billing. So you have your problem list and your billing list. Back to the problem list. From the problem list, you can actually add in a diagnosis code. Say, for instance, so if I select add to billing list, if I wanted to add a new one, I could just literally just right-click my mouse, and I can say I want to add a new problem. And if I add a new problem under the search, I can just basically put, let's just put abdominal pain. And I'll hit search. And the listings should be fairly comparable to what you're going to see with what you list in your IMO. In this case right here, I'm just going to put abdominal pain, cause unknown, and I can just double click it, and then I've now added it to the list. If I wanted to add that to my ICD, my billing list, I could just highlight it and click add to my billing list. And when I go over and I look at my billing list, then I'm going to be able to look at the abdominal pain, and you'll notice the ICD-9 code that's associated with abdominal pain. You do have the ability on the abdominal pain from the entry grid. This is, of course, just the listing, but I do have the ability to highlight and come down to the bottom and make any modifications to the description, put the onset date, put the resolve date if we had a resolve date. You're able to put in the status, whether it's active or inactive. Put any clinical status in here. Type what you want to in here. It shows the provider, the location. And then once you've made all your modifications, make sure you select accept. That will obviously change it. You can highlight any one of the conditions, and you can hit resolve it or set it to chronic conditions. You can delete it. So if you have a diagnosis code that's been put in by mistake and it shouldn't be there, then of course you can just take it and you can hit delete. By highlighting, I had abdominal pain, and it asked me, do you want to delete it? I'm going to say yes. And of course it did delete it. And then I can also remove it from my track problem. In this case, I put my headache. You'll notice that I've highlighted that. And I've shown mine that it's in the chronic and that I'm tracking it. But if I don't want it on the tracked, I can take it off of my tracked problems. You'll also notice that looking in the billing information from this, you still have the same exact options. You can add an ICD-9 code to the billing for the problems. You can resolve it by highlighting it. You can set it to a chronic condition. You once again have the ability to delete it. I'm going to go ahead and add a new ICD-9. In this case, we'll go back and we'll put that abdominal pain back in there again. Whoops. And whenever I hit search, actually I put enter, but you can hit search as well. Here's the listings for abdominal pain. If I wanted maybe for instance diabetes instead, these would be the codes and the associated descriptors and ICD-9 codes for 250 if I were going to be using diabetes with renal and search. Then it's going to start looking for anything that matches diabetes with renal, uncontrolled diabetes with renal complications, renal manifestations, and if this is the one I would just select it, or I could double click it and then enter. And now I've moved that into my list of unresolved diagnosis codes. If I wanted to set it to as a chronic, then I can highlight it and hit accept, and now I've moved it. You'll notice that it shows it as a chronic condition. Diagnosis module really and the medication module are the only ones that you're going to really see any changes for 5.8. During the next couple of weeks, we do go live on 5.8 on, it's going to be actually 2 weeks from yesterday, and the date on that would be the 24th. So the 22nd we'll be making the upgrade. We'll be spending the weekend making some modifications, any changes that we have to with the system. So it'll be down pretty much from Saturday all through Sunday. If we are able to get it up quickly, we'll send out emails to everyone. But just expect when you come in on Monday that you'll have 5.8. And it'll be set up in production. The other thing is I wanted to make sure that you're in 5.8 to double check to make sure that when you log and you're under 5.8, if you select help and go down to about Next Gen EHR, it'll let you know that you're in your test mode. If this was production, it would say production. Now when you came in on that Monday the 24th, it will actually say production, and there will be no changes with your login process that day. If you have any questions, feel free to give me a call. My cell phone is 817-707-4768, and I'll be sending out an email here in about the next 15 minutes that's going to have cheat sheets for all the information that I put on the recording. Thank you.